One of the earlier terms for this condition was given by Dr. Don Gass. He called them basal laminar drusen because he believed the pathology to be nodules on the basement membrane of the pigment epithelium. Subsequent pathology has found them to be in the same location as other drusen.
As with small hard drusen, cuticular drusen can be seen in the younger population. The difference, however, is that there are just too many to count. They can occur randomly or in clumps. They can occur in the macula or even outside the macula or nasal to the nerve, and this will be covered in the next chapter. Often, they can be seen either only or better with backscatter. Focus a narrow beam from the slit lamp on the pigment epithelium, and then look just to either side, and they will turn out and look like little translucent little spots. While this condition does put patients at risk in later years, it is not a high risk for early macular degeneration.
Recently, Fragiota et al. Divided cuticular drusen into 3 phenotypes. Type 1 is one that we usually think of classically, and these are where the clusters of drusen are centered in the macula. Type 2 has the cuticular drusen not only in the macula, but also extends outside the arcades and also nasal to the nerve. And then type 3 has both cuticular drusen and also large soft drusen. Here is an example of type 1 cuticular drusen. You can see they're small to medium-sized drusen. They are in clusters, and they're all in the central macula. The cuticular drusen can also be seen on the fundus autofluorescens, and this is one of the fairly typical patterns. You can see the hypoautofluorescence surrounded by an area of hyperautofluorescence. The red-free photographs are very similar to the color photographs in that there are no abnormal drusen that you do not see clinically, but you can see them a little bit easier with the red-free. The early phase of the angiogram of each eye is shown on the left side. You can see some early hyperfluorescence, which corresponds to the cuticular drusen. In the late phases, there's just a slight fading of the hypofluorescence, but they do not extend out from the cuticular drusen, so there's no leakage, but this is just late staining of the drusen. Here is a representative OCT in this patient. There's really nothing remarkable. As you look at the OCT, there are medium, small, and sized drusen, and you really couldn't tell a cuticular drusen from another type. So the cuticular drusen is going to be much more of a clinical and possibly angiographic diagnosis rather than an OCT diagnosis. This is a composite photograph of the same patient 8 years later. Vision remains at 20/25. You can see the cuticular drusen centered around the center of the macula, and also, because this is type 1, there are no drusen nasal to the nerve. And here is an example of type 2 cuticular drusen. You can see the cuticular drusen not only in the macula, but also there are extensive changes outside the arcades and especially nasal to the nerve. And here is an example of type 3. There are some small cuticular drusen. There are also some medium-sized, what look to be maybe soft drusen temporally, and larger drusen right near the fovea. And here are the red-free and fluorescein angiogram patterns of this last patient. The cuticular drusen are seen a little bit better on the fluorescein angiogram and has the early starry sky appearance. The larger drusen show up as staining spots in each eye. So, in summary, cuticular drusen is a very specific anatomical and disease pattern. Generally, they start at a much earlier age than classic macular degeneration, But there is a risk for late complications, and we'll cover this in the next section. There are three types: those that are centered only in the macula, cuticular drusen that are in the macula and also outside the arcades, and then the cuticular drusen that are combined with other regular styles of medium-sized drusen. The reticular drusen can be seen best with backlighting or on a fluorescein angiogram. Now also, there are no specific genetic markers that separates this style from anything else, and again, we'll get into that in the next chapter.